was really, it's historic, the way it is organic to the way this country developed. And of course that invites a whole set of problems, because when you leave your job, you leave your health insurance. And now, you know, it's been a long time since the average employee in this country stayed with the same employer for their whole career. We have great mobility for workers, and you know, it just, that's a model that does not work anymore. You know, you hear a lot of complaints about, I don't want the government to put their hands on my health care, I don't want them rationing my care. When an insurer tells you, when an insurance company bureaucrat tells you that we're not going to cover you because you've got a pre-existing condition, or an insurance company bureaucrat tells you you've got a monetary cap on how much you can benefit, you know, during your lifetime. That's rationing too. That's rationing as well. So
the problem we have right now with Medicare is George Bush, when he gave passed Medicare Advantage, put a freeze on the negotiating cheaper prices. Isn't that a fact?
That is an absolute.
Some of the suggestions I want to offer is, no matter what, we have to do something. 46 million uninsured is way too many, and our current employer-based system doesn't work. Fixing this is going to cost money, and we're going to have to face up to that. Not just the rich, but the middle class too. And to figure out a way to pay for it fair, almost a tactical or a political drive to try to oppose what the president is trying to do. Some may feel that and some may not. But I'm telling you, that's what I see. And I just want to say, I think the president is doing an awfully good job.
In the bill, I'm talking about what we're going to vote on, they'll pull that the heck out of there because of all the hullabaloo that's been raised about it. But I don't think it was intended as a death panel. I think they intended it to be...
Stop calling it a death panel.
A little bit so far. They intended it, you know, I mean, I think all of our families realize that sometimes, you know, you reach a decision that you want to know, like my family reached not long ago.
If everyone would allow the congressman to answer the question, we'll be able to hear the responses, and we'll have
I don't think people realize that we're already paid for universal health care. We just do it the most expensive way possible. Is fear-mongering. Fear-based responses. You have a good health plan, and so do I. You need to get counseling about dealing with things from a basis of fear. We have to deal from a basis of strength. We have to be part of the solution, or you are part of the problem. To even allow for people to use the terminology of death panels is wrong. The terminology is anything but a nasty mechanism to downgrade an important discussion between physicians and their patients who have rights to knowledge, and the physician needs the time and the reimbursement to take the time and discuss it with them. It is awful to distort the language and for you not to have the courage to say that it's wrong.
By only reimbursing them 100%, that's where that $550 billion over 10 years is coming from. And you know it. And you know it. Number two, you're a federal employee. Federal employees don't have to worry about pre-existing conditions. We still have to worry about pre-existing conditions. Federal employees don't have to worry about the medical cap. We have to worry about the medical cap. We want as good as insurance as you guys have.